My name is Dr. Kevin Sullivan, and I'm the Medical Director of Atlanta Access Care in Decatur, Georgia. I'd like to talk to you today about uterine fibroids. Fibroids are a benign growth in the uterus, and they can cause heavy bleeding, severe cramps, and other symptoms during menstrual periods. If you've been diagnosed with fibroids and you have these symptoms, it's very possible that you've been told you need surgery, such as a hysterectomy. But there is another option, which I perform, called uterine fibroid embolization, which is not surgery. This is a quick procedure. It can be performed in the morning, and you can be home the same day. Most women have had this procedure, are very pleased with the results, and what I'd like to do is have some of the patients that I've treated describe in their own words how this procedure has changed their lives.
I started having excessive bleeding and cramps and blood clogs, and my period wasn't normal. And I was worried about it.
One day I went to the doctor's office, and I was informed by the PA, the physician's assistant, that I possibly had fibroids. Well, I hadn't heard of it. I didn't think anything of it. And I went on, and several years later, I'm married and tried to have children, but ended up miscarrying because the fibroids were there.
If I moved, I risked the chance of messing up my clothes. If I stood up too fast, I risked the chance of messing up my clothes. At night, I messed up the bed. So I didn't want to go to work. I didn't want to be bothered.
So I had the traditional myomectomy, and it was difficult. I was out for 13 weeks, and I went back to work, but I went through a lot of pain. It should have been 8 weeks, but it was difficult, so it took me 13 weeks. So I went through the myomectomy. Well, 5 years later, I have another checkup. They've come back. They've grown back and everything. And I'm going through the same uncomfortable situation again with the cramps and the irritability, and I'm just miserable.
So I called my gynecologist, and they did exam on me, and he said to me that I had fibroids. And I was like, fibroids, what is that? And so my doctor explained to me what fibroids was, and I said, well, how do y'all treat fibroids? And he made it sound like the only way was to have a hysterectomy, to be rid of the problem.
And I saw a commercial for Atlanta Access Care with the UFE procedure. I called, I got an appointment. And I came in and I talked with Dr. Sullivan, and he explained the procedure to me.
My period is back to normal. I don't have the clots, I don't have the pain, the excessive pain that you have. It's a wonderful thing. I would recommend it to anybody.
I'm able to live, bottom line, I'm able to live and function on a normal level than what I was before.
And sure enough, I was up and running in about maybe 4 or 5 days. I was feeling fine. I didn't even have to finish the prescriptions that were given me, just return back to normal. And now today I have an average cycle, and I don't have cramps anymore. I don't have any pain anymore. The fibroids, I presume they are just shrunk or gone. So now I'm a different person today, so I don't have to live with that anymore. Something where I lived with for about 15 years, and but now I'm a new person.
It's been my privilege to help these patients, and if you have symptoms like these women, I can help you as well.